Hey guys, Dr. Childs here. Today we're going to be talking about the benefits of tyrosine supplementation. So if you are somebody who is interested in taking a supplement that can help improve your adrenals, your brain health, and even your thyroid gland, then you should find this information very helpful. So let's start with some of the basics. What is tyrosine? Tyrosine is considered a non-essential amino acid, which means your body can create it from other precursors. And the reason your body needs tyrosine is because it uses it to create certain neurotransmitters and certain hormones. And if your body is incapable of doing this to the degree that it needs, then you'll start to experience symptoms in some of the areas that we'll be talking about. Therefore, supplementation may cause benefit or may improve the outcome of some of these tissues. So let's talk about number one, and that is better thyroid health. So the use of tyrosine has been associated with better thyroid health. And here is probably why. Tyrosine forms the backbone to thyroid hormone. So what your body does is it takes tyrosine and it adds iodine onto it through a process called iodination. Now in this case, we added 4 iodine, so we just created T4 thyroid hormone. Now you can imagine a scenario in which perhaps your body is not doing this very well. Perhaps it does not have enough tyrosine. Well, what do you think will happen? You're not going to be able to produce enough thyroid hormone, therefore thyroid function will go down and you may end up with the symptoms of hypothyroidism. So there's a good use case in using tyrosine to boost the production of thyroid hormone, especially in patients who have Hashimoto's hypothyroidism or hypothyroidism from other causes, not just autoimmune thyroiditis. So number two, we also know there's a connection between tyrosine and adrenal health. And we know this because tyrosine is required for the production of norepinephrine as well as epinephrine. And we also have seen outcomes in patients or people who are athletes who take tyrosine and they see an improvement in their performance in the form of increased energy and more endurance. So it is likely the case that if you are using tyrosine, you may see a benefit in adrenal health and your ability to draw upon the demand of these two hormones, norepinephrine and epinephrine, which are also neurotransmitters, by the way, and allow you to get better outcomes when you are performing whatever sport or athletic event that you're performing. Number three, we also know that supplementation with tyrosine can improve brain health. And this is likely because tyrosine is required for the production of a very important neurotransmitter called dopamine. And guess what happens if you don't have enough dopamine? You may exhibit a number of issues, including depression, anxiety, ADD, etc. A lot of different conditions are associated with problems in dopamine. And in fact, we know that there are a number of studies showing that taking tyrosine can potentially benefit certain areas of brain health, including cognition, focus, brain fog, mental clarity, ADHD, alertness, and even depression. So if you're suffering from any of these, then a good use case may be to take tyrosine to try and boost those dopamine levels, which then will decrease certain symptoms like potentially depression or any of the others that I mentioned previously. And then lastly, we also know that tyrosine supplementation has the potential to improve your skin health. And that is because tyrosine is required for the production of melanin. Now, melanin acts to provide the pigment to your skin, right? So when you go out in the sun, you get a tan, you're increasing melanin production, and that gives you that tan. But we also know that melanin protects your skin from reactive oxygen species, right? So it actually acts as an antioxidant as well. So as I mentioned previously, there are a lot of potential benefits, but the question is, why does your body even benefit from the use of l-tyrosine when tyrosine deficiency is incredibly rare? Outside of genetic conditions like PKU, we just don't see people who are truly tyrosine deficient. And yet, people who take tyrosine supplementation still see a number of benefits. So I have two potential reasons for why this might be the case. One I call the demand hypothesis, and the other I call the stress hypothesis. So imagine with me for a second, we'll talk about the demand issue first. So it may be the case that, let's say you're in a situation where maybe you have a lot of depression, okay? And maybe your body has a high demand for dopamine at the same time. Now, maybe it's the case that your body is using tyrosine to produce dopamine and it's drawing away from the stores that your body would use to create thyroid hormone. So in this case, maybe it's not that you don't have enough, but maybe it's just improper utilization. And that's what I call the demand hypothesis. Now, the stress hypothesis is a little bit different. This is just a known physiologic component. And that is that when the body is under stress, it is not capable of making tyrosine from the precursor phenylalanine. So maybe it's just the case that environmental factors are limiting your body's ability to use tyrosine. In either event, we do know that supplementation with tyrosine can be beneficial. And if you're interested in using tyrosine supplement, the one that you want to look for is l-tyrosine. So tyrosine, l-tyrosine is an enantiomer of tyrosine. So that basically means it's a mirror image. And l-tyrosine is the form that is most biologically active and most stable. So if you are going to supplement, that's the one you're going to want to use. In terms of dosing, I recommend starting out small. So somewhere in the range of 100 to 500 milligrams, but you may be able to benefit and take a much higher dose. So we know from studies that safe doses can be as high as 150 milligrams per kilogram, which is a potentially huge dose. So don't be afraid of going up higher once you start out slow though, because if you start out slow, you might find that it's very stimulating to your thyroid and to your adrenals. You'll know if you're taking too much because you might start to experience symptoms like nausea, headache, heartburn, or even like a jittery or sort of anxiety-like feeling. And if that's the case, back down on your dose. In my opinion, the best use case for using l-tyrosine is for people who want to improve thyroid function, people who want to improve adrenal health, and people who are who are struggling with some brain condition, depression, anxiety, etc. I probably wouldn't use it solely for skin health, but if you want to give it a try, go for it. It's probably not going to cause any issues. If you are also looking to improve some of these other areas, then I would recommend, especially thyroid health, I'd recommend checking out this video, which talks about other supplements in addition to tyrosine that can help improve your thyroid function.